Hi, Eric Bakker, naturopath from way down under from New Zealand. Thanks for coming back. We're talking about Mast Cell Activation Syndrome. I'm doing a few videos on this particular topic today. Let's look at the signs and symptoms of Mast Cell Activation Syndrome. So we spoke about the white blood cells, the mast cells releasing chemicals. These things contain what we call granules. They become granulated. They swell up. They contain different chemicals which they will release into the environment depending on the trigger. So some of these chemicals will increase permeability, for example, of blood vessels, leading to swelling, congestion, inflammation, maybe itching of the skin, underlying areas where these blood vessels are. Other things that you're going to find will be increased mucus production. This will commonly occur too with histamine, with too much histamine secretion. So this mucus is produced, in response to a stimulation, which could lead to sinus and sneezing and congestion and, blocked nose and post-nasal drip and all kinds of problems. The other one, which I want to talk about is the contraction of smooth muscle. So some of these chemicals called cytokines release specific chemicals called interleukins, and these can be pro-inflammatory or anti-inflammatory. Some interleukins will stimulate the contraction, for example, of muscles. This can lead to cramping, for example, cramping pain of the digestive system. I've got cramp in my gut. What the hell's going on? There could be bladder problems. There could be bowel problems. So contraction of smooth muscle is not uncommon when we've got this mast cell activation. And people will think they've got a parasite of candida, when in fact they could well have, this contraction of the smooth muscle going on there. So bladder as well, there could be a bladder spasm going on there. So all these things are smooth muscle. The intestines are smooth muscle, and they can be affected by chemicals produced, in too high amount. So if we look at some of the typical signs and symptoms, I'll just read off a checklist here. Typical ones are skin rashes and hives, very common. Swelling and edema, remember we talked about the blood vessels. Also, they can leak more. So you can get more fluid leaking out of them, which can create more swelling, because we talked about the increased permeability being caused by this syndrome. Flushing, itching of the skin, prickling of the skin, abdominal pain and cramping. We talked about the smooth muscle contraction. Nausea, some people can even get a bit sick if the stomach gets involved in this area as well. Diarrhea, loose bowels. Some people can even get constipation or diarrhea or have irritable bowel syndrome as a result of this particular syndrome. Wheezing, shortness of breath, heart palpitations, anxiety, poor concentration, low blood pressure, fatigue. There's even a tachycardia, a particular syndrome, a fast heart beating syndrome that's been attributed to mast cell activation problems. So, all of these things can be as a result of chemicals released by these cells called mast cells. More and more, I'm noticing this in patients that are not responding, to normal therapies, where we have to start looking at taking particular foods out or changing the patient's environment to dumb down, this overreaction of the mast cells. But we'll talk about that in a subsequent video. So I think I mentioned these things: hives, swelling, flushing, nausea, low blood pressure. Some people can even faint, get very dizzy or faint. Red eyes is another one I forgot to mention. In the past, I've mistakenly looked at this syndrome and thought that the patient had adrenal fatigue, when in fact they had a mast cell activation problem. So I hope that gives you a bit of information on the signs and symptoms of this problem. Thanks for tuning in.